Hey, you guys. Hey, Dr. Ken. Thanks for joining me at the last minute. I'm tired. All right, there's a second person in here. I'm going to do a quick giveaway. Anyone who can tell whose song this is from, I'm going to send you a free black and gold mini kit with the mask color of your choice. You can choose between red, blue, purple, black, or camouflage. Reframe. It's a a giveaway, so it's automatically free. And you better not be Shazamming out there. No Shazam. All right, you guys, I'll stop playing with y'all. I'll stop playing with y'all. Guess I am excited. I am excited to save lives. I'm excited to give this information before I go back to work tomorrow, because I have answers to the questions that the patients ask me frequently at work. And they are: which COVID test is better than the other? What's the upside of antigen testing? What's the downside of antigen testing? What about this molecular test? What's the upside? What's the downside? And what about the antibody testing? And I'm going to go over that now for myself and for my patients tomorrow, and for you guys out there who might also have the same questions. And your first question might be, who am I? I am Dr. Khadisha. I'm your board certified emergency medicine physician, author of the best-selling book, Help Us Help You in the Emergency Room, what an ER doctor would tell you if she only had the time. And I'm also the creator of the Mobile MD Kit and the Mini Mobile MD Kit. And thank you so much for joining me tonight on this Sunday night. I know folks are going to go back to work, school, or whatever, and you're going to be hearing that discussion about, all right, which test is better? What about the false negatives, the false positives, and things like that. So that's what I wanted to go into today. And if you join my email list by going to www.drkhadisha.com, you can get on my list and get weekly updates from me, and I'll put that in the chat. And let's see, I'm putting that in the chat here. So go there and you'll get a welcome from me. You'll get to see a special presentation from me about the pandemic. And you'll also be able to join my list so that you can get weekly updates and other things from me. So whether it's in the ER or if I'm out and about, I'm constantly asked about the differences between these COVID-19 tests. So first, we'll just start with the basics, and you guys definitely join me in the comments. This is, despite I know there's a lot of information out there, we're just going to review and maybe go into it a little bit deeper than what you might already know. So, first of all, how many tests are there? Things are constantly changing, but currently and still, there are only 3 types of tests. Well, there's two categories. First, there are the diagnostic tests, the ones that tell you whether or not you have an active coronavirus infection. And then the second type is the antibody testing, which tells you that you had the coronavirus infection in the past. Hey, Dr. Carol, thank you so much for coming on. I know you're so busy today and you had a great show. I can't believe that this is the same day that started off with you doing your natural hair care episode with Dr. Zakia. I can't believe that this is the same day. So two sets of testing, two types of testing. One is diagnostic, the second is antibodies. So we'll start with the diagnostic testing first, okay? Because there are two types of diagnostic tests, again, the kind that tell you whether or not you have an active coronavirus infection. So the first kind of test is the molecular. And I'll just tell you now, I'm getting my information from the FDA and Harvard. So the first test is the molecular test. You might see the letters RT-PCR, and that refers to like the genetic material testing, because molecular testing is actually looking for the genetic material of the virus. And RT-PCR, that just refers to the genetic material. Okay, so the upside, they're also known as the viral test, the molecular test, the nucleic acid amplification test, or the LAMP test, or the RT-PCR test. And the molecular test is done either as a nasal or a throat swab. Most tests are nasal or throat, and there are a few tests that will test your saliva. It usually takes, and this is funny, how long does it take to get the results? Well, according to the FDA, you can get the results in the same day, and sometimes you might, or up to a week. And I know personally, because I've been cursed out by enough patients at work, that it can take 10 business days. So it can take 2 weeks for you to get the results. So I'm not looking forward to that tomorrow. Calling in positive and negative COVID testing results to patients who, since getting tested where I work, they've already gone to other places and gotten tested, got the results and everything before I even called them with their results from 2 weeks before. So it can be the same day, or it could be up to 10 business days. Is another test needed once you get the molecular RT-PCR test done? Is another test needed? This test is typically highly accurate and usually doesn't need to be repeated. So the downside is that this test can take up to 2 weeks to get results back, but sometimes you can get, it depends on the capacity of the laboratory. Sometimes you can get results in the same day. Sometimes it might be 3 to 5 business days. You might hear that, or 7 to 10 business days. But it's highly, highly accurate and does not need to be repeated, typically not. So it shows, again, whether or not you have an active coronavirus infection. This is the molecular testing. It's the most accurate. It might take the longest to get the results, and it tells you whether or not you have the active coronavirus infection, and it tests for the presence of the genetic material of the virus. Okay, so the second type of diagnostic testing is the antigen test, and it seems like we're hearing more and more about the rapid antigen testing because of the keyword rapid. And some molecular tests are also rapid tests, so I'll throw that caveat in there also. So the rapid antigen testing is a nasal or a throat swab as well. I've only seen, in my personal experience working at my ER and also getting tested at one of the City of Houston sites, I've only seen the nasal swab, but there are throat swabs out there. How long does it take to get the results? An hour or less. Is another test needed? Well, positive results are usually highly accurate, but negative results may need to be confirmed with a molecular test. And I will say that, and then we'll go over like the false negatives and positives. So, all right. So for the antigen testing, as far as accuracy, according to Harvard, the reported rate of false negative tests can be as high as 50%, unfortunately. Hey, Victoria, thank you so much for coming in. You were like one of the best people. We count on you to when we do our Facebook lives now, because you're so consistent. You're always there, and I hope you're greatly benefiting from this information because you're always there. We really appreciate you. So the antigen testing is the least accurate, but it's the most rapid. So upside, rapid results. Downside is the accuracy. It can be as high as 50%. And I heard about the incident where someone they didn't even use the swab on someone, and it came back positive. Now that was a very rare. That's a rare thing. It's a rare thing. So so the antigen tests aren't really favored by the FDA as a single test for infection, but it's quicker, it's less expensive, it's cheaper for facilities to do because it requires less technology to perform them, and and if there is a question, they can repeat the testing. That's also considered a reasonable strategy according to the Harvard report. Okay, but according to the test manufacturers who were asked, the false positive rate of antigen testing is 0. So don't expect false positives from the antigen testing, but you might get false negatives from the antigen testing, which is really popular right now because it's so fast. It's so fast. Okay, so Victoria, she's an awesome occupational therapist. She's an awesome Black female occupational therapist. Thank you, Dr. Carol. So that's the upside of rapid testing, rapid antigen testing, and thus the downside of rapid antigen testing. I'm focusing on this one because more and more places are offering rapid antigen testing because people want things fast. People want these done so that they can go back to work. We're finding people that we're seeing at my facility who get tested, test positive, they recover, and then they want to come back for that rapid test so that they can go back to work. Okay, so the diagnostic testing, we've pretty much covered that. And let me just say, for the molecular testing, as far as the accuracy of the molecular testing, while it's more accurate than the antigen testing, false negatives can be as low as 2%, or they can be as high as 37%. That's false negatives. So as low as 2% with molecular testing, or as high as 37%, based on the type of test that you use, because there's a number of manufacturers. And as far as false positives with molecular testing, that's barely an issue. That rate is 5% or lower. 5% or lower with molecular testing. Okay, so we've gotten the diagnostic testing out of the way. There's the molecular test, and then there's the antigen test under the umbrella of diagnostic testing to make sure or detect whether or not you have an active infection. So the second type of COVID-19 testing is the antibody testing. Okay, so the antibody testing is a serological test. It's a blood test. It's a serology test. And the SER refers to our serum. Our serum is like the the liquid part of the blood, like say if you put it in a centrifuge, like if you remember that from your high school chemistry class, you know, the spinner or the centrifuge. If you spun it down, if you spun a tube of blood down, the red blood cells would sink to the bottom and the serum would be floating on top. And it's like a golden, it's like a golden but clear liquid. And in that golden but clear liquid, which is our serum, lie the antibodies. So serum, serological, serology. That's why the antibody test is known as serology, because they're actually evaluating our blood serum for the presence of the antibodies from, just in general, viral, bacterial, fungal infections or whatever. They're all in the serum. So how is the sample taken? It could be a finger stick, thank goodness, or it could be a blood draw. Usually, I think it's, well, a blood draw would be more accurate, but the finger stick is more convenient. So, and how long does it take to get results? You could get same day results, or it could take 1 to 3 days to get results of antibody testing. And I should have mentioned that the antibody testing does not tell you whether or not you have an active coronavirus infection. It tells you if you had it in the past. It tells you if it had it in the past. And it's looking for the IgM antibodies, and it's looking for the IgG antibodies. And IgM antibodies, and I should say this too, that antibodies take a few weeks to develop. They do take a few weeks to develop in our system after getting over coronavirus infection or any infection. It takes a few weeks for the antibodies to show up. And they stay in our blood for several weeks, these antibodies do, or more. And researchers don't really know like how, like what the presence of antibodies mean as far as our immunity to the coronavirus in the future. I've heard estimates ranging from like maybe 3 to 5 months as far as being immune to a subsequent infection once you have antibodies. But really they don't know how long, you know, everyone could be as far as being immune. Okay, so you get the results in 1 to 3 days or maybe the same day. And another question, is another test needed once you get antibody testing done? Sometimes a second antibody test is needed for accurate results. Sometimes. And then what it shows again is if you've been infected by the coronavirus in the past. Now, as far as the, let me see if I can discuss accuracy for the antibody testing. So one thing that can interfere with the accuracy of antibody testing is testing too early to get the results. Like I said, it could take weeks for antibodies to develop in one's blood after an infection. But if you have the test, so if you have the test too early, like before you develop antibodies, then you could have false negative results. And I actually had a patient the week before last who was nervous because she knows she had the infection, but she said, they tested me and I don't have any antibodies yet. And it could have just been that she just hadn't developed them yet. I think when I saw her, she had the, she had come down with the infection maybe about 5 or 6 weeks ago. So when I saw her, it had been 5 to 6 weeks since she had the infection. She still didn't have antibodies, and I could see her being tested again like in the next week or two and her being positive for the antibodies because she looked fine. She wasn't immunocompromised or anything like that. So it just could have been that it was too early. So we're talking about the accuracy of the antibody testing that tells you whether or not you had the coronavirus infection in the past. So let's see. So the reported false negative rate of antibody testing is 20%. However, this is false negatives. However, the range of false negatives goes from 0% to 30%, depending on the study and when in the course of the infection for that person the test was performed. And research also lets us know that the antibody levels can decrease over after just a few months, and which is why we can't say that you having the infection in the past provides like long-term immunity. It does not. They expect that your immunity should dissipate after a few months. So while a positive antibody test proves that you've been exposed to the virus, it's not yet known whether such results indicate a lack of contagiousness or long-lasting protective immunity. So it's just another one of the downsides of this being a new virus, a novel coronavirus infection. We can't tell you whether or not you're still going to be contagious or how long the immunity is going to last. So, Harvard says ultimately that true accuracy of tests for COVID-19 is uncertain. Let's see. Dr. Carroll asks, are there standardized recommendations for how often educators should be tested? I'm not seeing that, but because it depends on the person and to whom they are exposed, and everyone's coming from different homes and things like that. I could see it being they would need like more widespread testing, like testing of the household contacts and knowing who those contacts might be contacting as well. So I know honestly, maybe testing once a week, healthcare workers and sanitation workers. Now, I've not heard about sanitation workers being tested regularly, but if they work in a hospital, I would want that to I would want to be tested if I was a sanitation worker working in a hospital. And as far as healthcare workers, there are healthcare workers who've never been tested, and I think it's like a dirty little thing that's going unsaid. I don't think they want to test. Many places don't want to test healthcare workers because, as long as we're asymptomatic, they just hope that we practice social distancing, masking up, washing hands, using sanitizer, because if they actually tested everybody, there might be a lot of folks who are asymptomatic carriers, and once you find out the person's positive, then they have to stay home. So I think a lot of facilities aren't testing people, especially if they have no symptoms. They're not testing them and just hoping that they will, practice safe practices as far as social distancing and masking up. So Victoria asked if in my experience, which of all these various tests is most accurate? So it seems like the molecular RT-PCR test is most accurate because it's testing for the genetic material, and the genetic material of anything is going to be the most accurate identifier, of an organism. So I could see why that would be the most accurate test, because the antigen testing tests for elements that are on the surface of the virus, and there might be because the coronavirus family is actually called the family Coronaviridae, because there's multiple coronaviruses in that family. And if the word corona means crown, and there are like crown-like projections on the surface of these viruses, so it could actually pick up the antigen testing might pick up a similar coronavirus that isn't COVID-19. There's always that risk. So That's why the antigen testing might not be as accurate as the molecular genetic material detection test, because it's testing for that. So let's see about because where I'm working, we're not being tested. At least, I don't know, I could go in tomorrow, and things change so quickly. I could go in tomorrow and find out that they're testing us every week. But really, I think that as long as people look good and they don't have a temperature, I think maybe the staff is doing temperature checks, then they won't feel the need to test on any kind of specific basis, because they really don't want people sitting out because they test positive and they have no symptoms. I don't think they're going to they're not going to look for something they don't want to find, especially if the person is walking, talking, and working well. I don't, it sounds like it should be happening, but I don't think people are getting tested on the regular. So, but yeah, correct me if I'm wrong in the comments. I hope, people are being tested regularly in multiple places, but from my experience, they're not. If you don't have symptoms, and if you don't have a fever, including a fever, especially a fever, you're not going to get tested as a healthcare worker unless you become really sick. Okay, hey Ricardo, speaking of healthcare workers, Ricardo Torres is one of my old co-workers, and you can, if you feel up to it, please let us know if where you're working, if you are regularly tested for COVID-19 at your job, or are they doing temperature checks? And Dr. Carroll, are they doing temperature checks at your job? Definitely let me know. Okay, so hospitalized. Let's see. So, and it's far like teachers, I wish they were checking that. And I think actually there was a school district in Georgia where they had started school in person, and they found out that about 60 people, it might have been staff, students, or a mixture of staff and students, 60 people were found to be coronavirus positive, and they backtracked and made school virtual again. So that did happen in Georgia. So there was some testing that they found people. Okay, daily temperature checks. Okay. And 60 school COVID positive in Georgia. Okay, so and at my job, the staff gets daily temperature checks. Okay, so on August 10th, according to CBS News, there was a Georgia school seen in a viral photo. Oh, well, this was after 9 students, so this wasn't this is another instance. There was a high school that was featured in a viral photo showing students packed tightly in a hallway. Oh, and they closed temporarily after 9 students and staff members tested positive for the coronavirus. This was the North Paulding High School in Dallas, Georgia, when they reopened for in-person learning on August 3rd. It's like, the hallway was full of students. So, okay, any other questions or comments? So so I think that's what folks are doing. They're doing the temperature checks, and you might get tested if you have symptoms. Otherwise, a lot of places are not going to go sniffing for something they don't want to find. They don't want to find that people are positive and have to send people home. But I hope this review of the 2 types of COVID-19 testing, diagnostic and antibody, were helpful. Diagnostic has two types, the antigen and the molecular. Molecular being more accurate, but the antigen, typically rapid, is faster, so it's more convenient, it's cheaper to perform, but yeah, less accurate. Let's see. And then the second is the antibody testing, which doesn't tell you if you have an active infection like the diagnostic testing does, but the antibody testing at least tells you whether or not you have antibodies. The downside is, everyone's a little bit different. It takes weeks for antibodies to develop, so you might test too early for that person to detect their antibodies, and you might have to repeat the antibody test again to make sure that they have antibodies. Okay, so Dr. Carroll says in the countries that did the test widely, they were able to better contain the virus. And that's what city leaders are calling for. Like here in Houston, the head of EMS here said maybe last week or the week before that if, the ideal situation would be if all of us got tested once a week. Then that way, once you knew you were positive, you quarantined for 2 weeks, maybe up to 21 days, and that would be the best way to get on top of doing the testing. I've heard the number of 1 million tests a day being needed to really get on top of testing, and we're not close nationally to 1 million tests a day. We still aren't. Even though the rapid antigen testing, I'm seeing it's exploding everywhere. Houston has more than 20 testing sites, across Harris County, in order to increase testing and get on top of it. But it's going to take a while probably before we get on top of testing. But this is what we have to do until we get a vaccine, which is really the way that we're going to be free of this and bring this pandemic to an end. That's what it's going to take for us to be able to take off our mask. Herd immunity. Herd meaning that out of the group of us, a certain number of us are immune to this infection. Enough of us are immune such that those people who refuse to take the vaccine aren't a factor. They can not be protected because the people around them are protected. And the safest way to achieve herd immunity is through vaccination. And the vaccine won't be widely available. It's hoped that it'll be widely available next year, so sometime in 2021. But given the fact that enough of us are not wearing masks, enough of us are not social distancing, enough of us don't believe that this is real, Christmas won't happen, in-person Christmas without the risk of an explosion of cases or without the risk of that being some kind of super spreading activity. That's the risk that we're going to have to take for this holiday season. And yes, Dr. Crow says vote for candidates who are supporting the science. We have to vote for candidates who are supporting the science, who are listening to the healthcare professionals, who are not stifling their statements and trying to alienate them and cover up reports and things like that. We have to support candidates who do that. But yeah, so until we get that vaccine that's widely available and 2/3 of us become immune, because that is specifically what it's going to take for COVID-19. Herd immunity from COVID-19 is going to need. It's going to take 60 to 70% of us being immune. That's going to take, I don't know if we'll be able to, hopefully we can achieve that by the end of 2021, but that's what it's going to take. So if you're in a discussion and someone says, what is it going to take for this to end? It's going to take herd immunity for COVID-19 being 60 to 70% of the world's population being immune to the disease. That's what it's going to take. 60 to 70% of the world's population being immune to the disease. And until then, you're going to get sick of hearing this. I'm surprised people aren't sick of hearing this. You're going to have to mask up, use sanitizer, wash your hands, stay at least 6 feet apart, and and if you have symptoms, stay home for at least 2 weeks. And and then if you're exercising, there's another thing I wanted to mention. Look up the term slipstream, SLIP stream. When you're out exercising, try to stay at least 12 feet away from people who are exercising, especially those people without masks, because the respiratory droplets from people who are running, cycling, or skating, it can blow from them as far as 12 feet and infect someone who is within a 12-foot radius of that person. So go to www.drkadisha.com and you can check out my special presentation on how to be safe and well during the pandemic. I discuss this and more because I really want to get this message out. If someone could type in the comments, www.drkadisha.com. Please do go there for this free special presentation. And in the meantime, while we're waiting for that vaccine, definitely get your mask, your sanitizer, things like that together, and ways of checking your temperature so that maybe you can catch yourself before going into some place and having them tell you that you have a fever. And if you can't get all those things together, you can get it from me. Here's the Mobile MD kit. This is the cute, clear, purple and gold one. I also have a black and gold one that's, if you don't like the cute, clear one, I've got masks in there. I've got about two of everything. 2 surgical masks, 2 bottles of sanitizer. Thank you, Dr. Carol. 2 pair of gloves, and I know gloves are controversial, but the thing is you have to properly use them. But if you don't have sanitizer and you're doing something like pumping gas or some other dirty chore, use these. Use them for the specific task and dispose them. Do not wear them for prolonged periods. So I've got gloves, mask, sanitizer, forehead thermometer strips in these really nice cases. Now the black kit has the forehead thermometer strips, but it doesn't come in these little cases. But you'll see these reusable forehead thermometer strips. And I also have ear savers for the mask. So, say you're tired of wearing them behind your ears, or they become loose, or there's some irritation behind the ears, you can use these and you can put them behind your head, and then the loops go that way. And then by special request from my friends and medical moguls, I also included antibiotic ointment, Band-Aids, and alcohol pads in case you cut your finger. So it's like a mini first aid kit and more. So yeah, you can also go to www.drkadisha.com for that also, so that we can all be safe, because we're not going to get over this until we're all doing the same thing, and everyone needs to have their own source of these types of things. And this also allows you to share with someone else if they are very close to you, can't social distance, and they don't have these, and they're not raising hell about wearing a mask. If they are raising hell about wearing a mask, get away from them. But yes, definitely get these so that we can all be safe together and get back to the lifestyle, the lives that we love, the concerts, church, picnics, family reunions, weddings, even funerals, the way that we're used to doing them. That's the only way to get around this. Yes, Dr. Carol has hers, and everyone needs to get theirs. Everyone needs to get theirs. Check out that. Thank you, Victoria, for putting that in the chat there. Do get yours if you can't get all these things together on your own, because this is what we have to do until the vaccine is widely available. So guys, thank you for listening to me. I've been on here about 43 minutes. I'm Dr. Khadisha, your board certified emergency medicine physician, 20 years in the game, and author of the book Help Us Help You in the ER. You'll see that on drkhadisha.com also. And creator of the Mobile MD Kit and the Mini Mobile MD Kit. Get yours, get safe. Let's get back to the life that we all loved. And follow me on Instagram there. Yes, great for our COVID Christmas, our COVID Thanksgiving. Even for this COVID back to school, while the United States government is supposedly providing 125 million masks to schools, you know what it's like being a child in school and trying to get something that is passed out to everyone. They might lose a mask, they might destroy it, someone else might destroy it, it could become soiled. Make sure that your kids have their own kits for school. And I'm Dr. Khadisha. Thank you so much for joining me tonight. Please hit like, hit share, so we can get the message out, so that we can get back to the old way we used to live. And you guys have a great night. Thank you. Good night.